Okay, so hello and welcome to our TENF Healthcare Solutions webinar using HQM 5.2.2 from MIPS Submission, what you need to know. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for TENF. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We'll send out a copy of the slides and the recording within the next week. Next, for those of you who aren't familiar with TENF, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare, and we're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen, and we also have two NextGen add-on productivity solutions, CheckGuard and Refund Manager. Next, I wanted to mention some upcoming webinars. First, on Wednesday, March 14th, we'll be presenting a webinar on transforming patient access to behavioral health using telemedicine. Then on March 28th, we'll be presenting a new perspective on the NextGen Patient Portal. I'll be sending out more information on these two webinars along with registration information a week before each webinar, so keep your eyes out for that. Okay, so back to today's webinar on using HQM for MIPS submission. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenter for today. Lindsay Lanning is our healthcare compliance consultant at ITENIB. She specializes in healthcare regulatory compliance, federal initiatives, government and industry affairs. Lindsay possesses a deep understanding of complex compliance issues and their need to be addressed in a thoughtful manner to avoid negative regulatory repercussions that could impact a practice's reputation and bottom line. She's a true MIPS expert with lots of hands-on experience using HQM, so she brings a lot of knowledge to this subject. We'll also have Mary Hart and Catherine Gracita to help with questions at the end as well. They live and breathe NextGen, so we're excited to have them join us. So Lindsay, the webinar is all yours. Take it away.
Perfect. Thank you so much, Chelsea. Hi, everyone. Again, thank you for joining us today for our webinar, Using the HQM for MIPS Submission, What You Need to Know. So if you're responsible for your practice's quality reporting and MIPS data, you may be feeling a bit overwhelmed by reporting under MIPS and not sure how you can track or submit your data to CMS. Don't worry, we really are here to help. In this webinar, we're actually going to provide an overview of the NextGen Health Quality Measures web portal with its functionality and updates. We will walk you through the submission process from start to finish and identify new portal features that make submitting data even easier than ever before. We're also going to provide lessons learned through our experience with the 2017 submission process and point out common pitfalls and how to avoid them. These include common errors and warnings found in your program submission files, all the way to tips and tricks while configuring measures to ensure optimal results. We really do understand the complexities surrounding this new program and the impact it can have on your practice's bottom line and reputation, which is why we really want to help make this process as easy as possible and get you the highest composite score possible. So let's go ahead and jump right into it by asking the most basic question there is. What is NextGen HQM? The NextGen Health Quality Measures is a clinical data repository used for registry reporting of clinical outcomes and quality measure data. NextGen HQM extracts patient data from the NextGen report server to allow report generation for performance-based incentive programs. These programs can include ACOs or accountable care organizations, ambulatory surgery centers, the Comprehensive Primary Care Plus program, and MIPS reporting. NextGen HQM is a registry and a data submission vendor, which means they can submit data for all three MIPS categories and that CPC Plus program. Of all these programs that HQM has the capability to extract and track data on, MIPS reporting is what we will be exclusively looking at today. Now, I don't plan on going over the requirements under MIPS or the program itself, as I have in previous webinars. Today, we are strictly looking at how the HQM can facilitate the submission of MIPS data to CMS for 2017, including all those tips and tricks I've learned from helping over 20+ clients and counting submit these past 2 months. But let's not get ahead of ourselves here. Let's start with the basics. For the next few slides, I'm actually going to go over the fundamentals everyone should be familiar with if you're working in the HQM portal, but are crucial when it comes time to submit. First off is the HQM homepage. The homepage appears when you log onto the HQM portal. The user will see information such as the client site name, which is important if you're trying to communicate with the HQM team, since it doesn't always match your practice name. System messages or alerts, data processing status, which will let the user know if the job is complete or in progress, the last process date, or if for some reason no data has been processed. And lastly, if you've logged into the portal before and run reports, you will see your latest and favorite reports, which are tracked at the user level. Of those components I just named on the homepage, arguably the most important one is the job status. On the homepage, if you hover over or click on processing complete, or if it says in progress, the job status quick view panel will appear. The panel shows the job status in 3 different steps, and it actually utilizes a color-coded system to show progress. So green indicates the step is completed, blue indicates the step is actually being executed, and white indicates that it hasn't started. The panel also displays the date that the latest piece of data was extracted and the number of days for the data delay. This is really important when submitting MIPS data using the HQM, as you will have to kick off a new job multiple times throughout the process. This tells you when the job is complete and when it ran last. If the job isn't running consistently, your reports won't update to accurately reflect your configurations, which could hold you back from submitting. To put it in perspective, after the countless errors and warnings I've encountered with clients throughout the submission process, 75% were resolved by just kicking off a new job. And the other 15% that actually required a different fix ended up needing the job to be ran regardless. So I promise you, you will use this job status view panel at some point throughout this process. With that being said, you might be wondering when your reports are being updated with new data from NextGen. Well, reports pull from a copy of prod. Data reflected will typically be 1 day behind the last process date. There is a 14-day delay in pulling data to the reports. This allows for completion of encounter data so results are not skewed. Do want to note this configuration can be edited by requesting a change through your HQM analyst. One thing we do want to stress is to make sure your report server copy of prod is getting refreshed on a daily basis. If the copy of prod is not up to date, HQM will not be able to pick up current clinical data, and therefore your reports won't be accurate. I did mention that periodically the HQM will display announcements on the homepage. These messages are important and almost always affect you, the end user, in some way. A lot of people tend to overlook these, may not have time to scroll through the alerts, so NextGen did try and make it easy and actually color code them. If a message is blue, like the one you see on the screen, it contains general information or deadlines. If it's green, it means the product, it's talking about product deployments or updates. And then if it's red, it means it's relaying expected downtime. Obviously, these messages take on a greater weight during the submission period because downtime and deadlines are important to plan for, and then updates could actually contain fixes to known issues affecting you. Lastly, not only on the home page, but on every page in the HQM portal, in the top right-hand corner, there's a magnifying glass icon. And if you click it, users can actually perform a keyword search and access measure white papers that provide detailed information about program measures, all from within the HQM. This is a huge time saver. Instead of having to open up another browser, log into the success community, search for the correct white paper, and then wait for it to download, this eliminates that need and gives HQM users white papers at your fingertips when you're already analyzing reports or have questions on measure specifications. I can't tell you how many clients ask me, well, how does this measure pull from NextGen into the HQM? Because I'm not sure if that numerator on my report is correct. All you have to do is search the measure and pull up the white paper to get those answers. All right, so on to the measure configuration process, where users can alter their reports to reflect the measures they want to report on by adding or deleting them. Now, before you start making all these changes, you need to know how to actually get to the page where you can configure measures for providers participating in these programs. So on that menu bar, just click Config and then Measures. On this page, again, users can add or remove providers, add or remove measures for those providers, and also change the reporting period. These configuration changes are edited and saved by program and practice. When I say program, I'm referring to the quality reports you run for MIPS. So under the MIPS program, there are 3 categories providers are required to report on in 2017. Advancing Care Information, or ACI, Quality, and then Improvement Activities, or IAs. Each of these categories has a corresponding program within the HQM for either individual or group reporting that must be configured to report on. To make any configuration changes, select the program from the program list. In this list, the programs are listed by year in descending order, and then within the year, each program is actually listed in alphabetical order to make it easy. But after the program is selected, you have to confirm your practice selection from the dropdown as well. And this practice selection actually dictates which providers will appear underneath in those tiles. Again, the providers associated with that practice will show up as small tiles that display the number of measures assigned to each provider in a small blue circle, and it actually changes based on the program selected. If the user clicks on a provider box or a tile, a window will pop up, and it'll show the list of assigned measures, the provider's NPI, which should have a green background with a check, and that indicates it's been verified, and the reporting period, which can be auto-configured or customized by clicking that calendar icon. Another cool feature often overlooked on this window is the ability to show or hide measure tags by clicking the check mark found under the calendar icon. Now you might be wondering what measure tags are. Essentially, they are small badges found below a measure that give more information on the type of measure it is. These tags are different based on the program we're looking at. So for example, the quality programs or the CQM and or PQRS reports will show measures as either inverse, outcome, or high priority. These are helpful, especially since for this category under MIPS, you have to have an outcome measure or at least a high priority measure added to be in compliance with CMS standards. The improvement activity program will have measures with a high or medium weight tag and possibly an ACI bonus tag. Again, very helpful since under MIPS, this category requires a certain amount of activities, and that depends on the weight of the measure. And lastly, the ACI program will have the measure tag of either base versus performance measure. Base measures in the ACI category are required, and if they're not met, no credit is awarded in the entire category. So this was a little bit of a tangent from the actual measure configuration process, but again, the point of this webinar is to go deeper than just the process basics here, and hopefully provide you all with additional information that'll make this easier and help you in the future as well. So back to the actual measure configuration workflow within the HQM. To add measures for the ACI, CQM, PQRS, or IA program, all you need to do is click that green plus icon. The Adding Measures page appears where the users will select the practice, the provider, and measures they wish to add. And then the user will actually hit Complete to add measures. Sounds pretty easy, right? So if we take a look at the Adding Measures page, we'll see users can actually hover over any measure to display the measure description. Again, measure tags can be found below the measure name for all program measures. These are very similar to the ones we just went over. The only difference here on this page is that for the ACI category, we're going to see Medicaid and ACI measures are separated out. And then for the quality programs, we will see specialties listed below as well. Another source of help information on this page are the star icons located on some ACI measures. These indicate mandatory measures for the ACI category and will automatically be selected for you. Any other selected measures will actually highlight in green and have a check mark next to it. Obviously, if we add measures for a provider, we need to have a way to delete them as well, and there are a few different ways to do so. To delete all measures for a provider, select the X below the provider's name and then the red X when the confirmation message appears. To delete an individual measure for a provider, you just simply select the provider and then click the red X next to the measure in that window that pops up. This will remove that specific measure for that provider and that specific program only. Another alternative to viewing measures is to actually group search results by measure participation versus provider name. To do so, click the Change Grouping button. This will allow the user to select a measure in the dropdown, and any provider who has that measure added will appear beneath. And then that red X will remove the measure from all providers. This is another really easy way to configure measures for group reporting on a large scale. But don't panic if you don't like this option and you just wanted to try it. To revert to the original grouping by provider name, you just have to click that Change Grouping button again. So as we move forward, we're going to look at each of the 3 categories and the specific surrounding measure configuration for each category. So first up is ACI. This is a pretty easy category because everyone should have the same measures added. Now, there are some exceptions to this, and we will cover those. But in general, for most clinicians, you should have the following measures added to your ACI program. First, e-prescribing. Include or exclude narcotics. You need to have one or the other, not both. Health information exchange, patient electronic access, part 1, timely access, with ACI transition in parentheses after it, not Medicaid. Medication reconciliation, patient-specific education, secure messaging, and then patient electronic access part 2. Now, this only applies if you are not claiming an exclusion for a measure. And again, you're reporting under MIPS, not Medicaid, which should be the vast majority of you on the call today. Now, even if you are familiar with MIPS and the program requirements, something unique to the HQM and new this year is the addition of self-attestation measures. These were added as a result of the added functionality to actually be able to submit your meaningful use data to CMS instead of that manual attestation process done through the CMS portal. To navigate to the page where these can be added, go ahead and go under Config and then ACI and MU settings. The self-attestation tab actually enables clients to select self-attestation measures for the ACI program for providers by practice. However, it's important to note that once these are added, they can't be removed. Well, they can, but you as an HQM user are unable to remove them. You would need to reach out to an HQM analyst at NextGen and have them remove it. These, again, are extremely important because all practices will need to add the following measures, or an error will appear on your ACI program submission file, preventing you from being able to submit to CMS. So the first one is the ONC direct review, then you have prevention of information blocking, ONC surveillance, and then attesting yes to having a security risk analysis on file. Now, you may remember when you logged into the CMS portal for meaningful use attestation in previous years, you had to click yes multiple times in order to even enter the portal. These are those pre-attestation measures you are essentially saying yes to by adding them to your report. So these aren't new. You've attested yes to them before in previous years. If you read the page, you'll recognize them. If not, that's what these are. Now, you only want to add specialized registry reporting, syndromic surveillance reporting, or immunization registry reporting if you're participating in these and are in active engagement. You also only want to add either the low volume permissible prescriptions to claim an exclusion for e-prescribing, or the low volume outgoing transfer of care to claim an exclusion for the HIE measure. Otherwise, you don't need to add any of those. Now, to actually add a measure from this page is a bit different than what we're used to. First off, selecting a measure will bring up the measure description and disclaimer. It has the hovering capability to see this as well. Once Add is clicked, the user will see a green bar across the top of the screen, letting the user know the measure was added successfully. The measure will then show in each provider box on the config measure page, and at the end of your report summary. Once the self-attestation measures are added to the report and it is regenerated, the user will see a special note at the top of the summary report that all self-attestation and bonus measures show at the end of the report. So you can use those blue arrows to navigate to the last page, and then these measures should appear with a status of yes. Again, these won't show up until after the job runs, after they were added. This is one of the reasons why knowing how to check that job status on the home page is important. Now, I pointed out that there were measure exclusions available to add on the self-attestation tab. If you claim either measure exclusion, so e-prescribing would be the low volume permissible prescriptions, and the health information exchange would be low volume outgoing transfer of care, this means you have less than 100 in the denominator for this measure. Now, I do want to make very clear, you do not have to claim an exclusion if you have less than 100 in the denominator. It is just an option for those that have a 0 in the numerator and would not have been able to get credit in the ACI category otherwise. Taking an exclusion will allow you to fulfill your base score to get credit in the ACI category, but it will not count towards your performance score for the HIE measure. A very helpful tip I can offer you here, gained from issues submitting last month, you will have to remove the original measure, so the original HIE or e-prescribing measure, on the measure config page for any provider you are claiming the exclusion for, or you will get an error on your ACI program submission file. I do want to point out as well, if you have less than 100 in the denominator for either of these measures, and you choose not to claim the exclusion because you have data in the numerator, you will still get a warning on your program submission file letting you know you can claim one. You can ignore this. And since it's a warning, this is not going to be a hard stop. It's not going to prevent you from submitting. Just don't be surprised if you see this. The next category we will look at in the measure configuration process is the improvement activities. This is a brand new category. It wasn't derived from a legacy program like PQRS or Meaningful Use. So we will go ahead and show the whole process for configuring these activities. Configuration is essentially the same as other programs. You would need to select the program as improvement activities, either individual or group, select the practice, and then select the Add Measures green button. Adding measures for improvement activities screen displays for you to actually add your practice. And above that, you can see an orange exclamation mark. If you click this, you can see the rules for meeting improvement activities for MIPS. So if you're a standard practice versus a small practice, the requirements are different, as well as if you're a PCMH. Once the practice and providers are designated, the activities will appear for selection. To see a description of the activity, just mouse over the measure. Selected measures again, we're used to this highlighting in green and having a check mark next to it. You will notice measures have the blue tags we went over. One I didn't cover was the maximum weight, and that fulfills the whole category. This is found on the PCMH option for activities, since if you're part of a PCMH, you get full credit in this category no matter what. And then the others I already went over. The schedule appears once your measures have been selected for you to select your reporting period. And then once the reporting period is selected, the complete Add Measures bar appears, which you will hit to actually complete the process. Once added, the providers with the improvement activity measures will display the number of measures selected, and you can click the provider to see the list of activities selected and the reporting period. This is exactly how the other programs work as well. Just wanted to show you the screenshot so you'd be familiar with it once you logged into your own HQM portal. Now to actually view your improvement activities report, you would go into Reports, Quality Program Reports, and Improvement Activities Program will be available for selection on that reports page. Once selected, proceed as normal, running your summary report. The summary report displays improvement activities configured by showing participating and then having a yes in that column. Now, if you select an improvement activity eligible for ACI bonus, which is noted by that blue tag on each activity, the user will receive bonus points in the ACI category. The improvement activity bonus using CEHRT will show up automatically on your ACI report after you add the improvement activity and regenerate your reports. This is extremely important again. The bonus will not show up unless the ACI and IA reports are regenerated after the activity has been added. This has to occur prior to submission, or else you won't get bonus points you're entitled to. CMS even published a press release a few weeks ago that providers were submitting activities eligible for bonus points in the ACI category, and they weren't getting them because they were not on their QRDA submission file. So submitting with the HQM will actually allow you to see it added to the bottom of your ACI report, as well as your ACI program submission file, which are the two screenshots you see. So again, I can't stress this enough. Make sure you regenerate your reports, ACI and IA, after adding activities, and make sure to check your ACI summary report and submission file for that bonus as a line item. On to our last category under MIPS, quality. Good news here, these reports have not changed. They were previously used for the PQRS program and or the CQM portion of Medicare Meaningful Use. You can choose to either use PQRS or CQM measures under the MIPS program. PQRS is technically called Registry Submission Method, and CQM, EHR Submission Method. You do have the option, because the HQM is both a qualified registry and EHR submission vendor. So the decision really depends what will benefit your practice more. You just cannot mix submission methods. Providers are required to report on 6 measures, including an outcome measure or a high priority measure if an outcome measure is not available. So I always get the question, which one should I pick or which one's better? And the answer really is it depends on your practice. The measures capture data differently, so there are workflow variances. For instance, the PQRS measures tend to be a bit more flexible workflow-wise, where CQMs tend to depend more on the codes used and have multiple denominator requirements. The best reporting option for your providers depends, again, on your specific practice. There is no one-size-fits-all answer. You need to run both reports, benchmark the measures, and determine which gives you a higher score. Now that we've made it through all of the categories for 2017 MIPS submission and you're more familiar with the process, you can see there are some decisions you have to make before the final configuration process can take place. First off, you have to decide if you're reporting as a group or individual, since that will determine the program you select when configuring measures. Secondly, you have to decide how long you're going to report for. In 2017, providers have the option to do a full year or 90 days. And whenever you add a measure or an activity, it always prompts you to select the reporting period or schedule. And then lastly, what we just went over, which program you will use to submit your quality category data, either PQRS or CQM. So while there are some decisions you need to make, and these will vary on a client-by-client basis, there is one thing that remains consistent. One thing I can tell you with 100% certainty is that at some point in this measure configuration and submission process, you will have to regenerate your reports in order to have them show your data properly. Programs can actually be regenerated when one of the following conditions are met: when measures are added or deleted to a provider, when measure periods are modified, when provider emails, NPIs, or TINs are modified, if test patients are added or removed, and then a few others, as well as message categories if they're modified. Now, the most likely reason yours will be available to regenerate are for measures being added or removed, or if the reporting period is altered at all. To regenerate a report, you simply go under Reports and then Regenerate. You will see a list of the reports eligible to be kicked off on this page. Yellow indicates changes to programs that are actually available for you to regenerate. To do so, just click the looped arrow, and then that green circle with a check mark indicates completed report regeneration. However, reports are disabled for 2 hours after they are regenerated. So if you kick off your ACI report at 9 a.m. to reflect changes you made to measures included for a provider, and you go back in to delete one more you forgot about, you won't be able to regenerate that ACI report again until 11 a.m. that day. And finally, the last topic in the configuration section is a new feature called the validation report. The validation report enables you to verify the completeness and accuracy of your reporting data before it's submitted. For certain programs, when a quality report is run, your data is evaluated and the validation report is generated, listing the errors and warnings that have been triggered by your data for not meeting the required reporting standards. So you would run a quality report for a program and then click the Show Validation Report icon in the top right. The validation report appears to the right of the report. Any errors or warnings display. And submission file status information appears at the top of the validation report. So it shows the number of files generated, the number of files approved, any files that were submitted to CMS or rejected to CMS, and then any outdated files. Basically, this shows you what your submission file will show you without you having to generate it separately. This is a good tool to use when your final configurations are complete, to look at this and predict what your program submission file will look like if there will be any errors or warnings. Maybe you claim the exclusion for e-prescribing, but you forgot to delete out the original measure. By running this, it will show you that error. Again, it's just a great tool to double check your reports. Okay, so moving on to the actual submission process. Good news here, the submission process is identical for all three categories under MIPS. First, you have the final measure and reporting period configuration for the ACI, IA, and then quality report. Basically, everything we just went over. Step 2, you will need to regenerate reports since the HQM job must run post-configuration to pull that data. Step 3, you will then generate the program submission files for each category, correct any errors and warnings, and then finally approve. Seems simple enough, right? And since we already covered the configuration process and how to regenerate a report, we can skip right to step number 3, generating a submission file. To do this, the user must have the client admin role, and they would go under admin and then program submission. The program submissions page displays, and the user will need to click the Generate Medicare QPP button. It's that blue one with the gears. Once clicked, the Generate button changes in color and shows generating while creating the files. If reports are not available for the program, then the Generate Medicare QPP button will not display. Instead, Evaluation Required displays, which you see in that bottom screenshot. This means the job has not kicked off and the report has not ran initially, so you have to regenerate this one manually using the workflow we went over before. The previous steps to generate files will need to be completed for each MIPS category. That means you should press the Generate Medicare QPP file button 3 times, once for an ACI file, once for an improvement activity file, and once for a quality file. The files generate after a few minutes and are visible once the page is refreshed. Once the files generate and display on the page, like you see in the screenshot, the number of files display, the number of warnings and errors for all files display. Warnings and errors do display in color if they have items listed. If they don't, they just show up in white. The client admin user will need to review each program category's file by clicking View Files. However, only one MIPS category file can be displayed at a time. All files for the category display, each with a file name, a status, the option to view the file, and if any alerts or warnings exist. This view, again, is the same for all 3 categories. And to view the actual JSON file, the user will actually click View File again. The client admin user actually views the JSON file contents to confirm it's all correct. Obviously, I redacted any practice information here, but you want to double check each line item compared to your summary report for the measures. but you also want to make sure to double check that your NPI and TIN are correct at the top. Above the report, a download option is provided if you want to save a copy for your audit binder. I will warn you, this is just the raw data. There's absolutely no formatting, and it opens in Notepad, so it can be hard to read. To the right of the report, any errors or warnings are listed, or a message states that there are no errors and warnings. Error corrections must be made before a file can be submitted. Beneath the errors and warnings, the user will actually approve the file. If the file has been approved already, the name of the approver, the date of approval are shown, and then the word approved is followed by a check mark. So errors and warnings can occur for many reasons, such as an invalid TIN or NPI, missing measure information, or failure to comply with CMS requirements. Program submission file errors appear to the right of the report in the file viewer, and errors are identified by a red left border. And different types of errors display based on the program. Errors are the more serious of the two alerts. They actually prevent preview data in the MIPS dashboard, and they prevent the approval of the submission file. You can resolve errors by clicking the wrench icon to view it, follow the instructions on how to actually resolve it, and then if you mark it resolved, it will actually change to blue and have a check mark to show resolved. Now, some of the most common errors I've seen while assisting clients submit are on the ACI report. The error will say, the provider has not met base measures. What I have found most often is that either the self-attestation measures have not been added and the job rerun. This is important since one of the base measures is security risk analysis, which is a self-attestation measure. This error could also pop up if you're claiming an exclusion and the exclusion and measure are both on the report. Remember, you can only have one of those. Another error on the ACI report that's common is having both e-prescribing measures added. NextGen gives clients the choice to either include or exclude narcotics for their e-prescribing measure. It doesn't matter which one you report on, but you can only have one configured, not both. And another one I've seen a lot is on the CQM group report. It says TIN does not include all providers with a matching TIN. This was a known issue, however, it has been resolved. Now, going forward, the only reason that error will stay is if you don't have certain providers with the practice TIN configured. This means everyone with a matching TIN needs to have the same configuration if you're doing group reporting. Now, program submission file warnings are displayed beneath any errors to the right of the table or report in the file viewer. Warnings are identified by an orange left border. Warnings really alert you if your measure information does not comply with CMS requirements, if a measure can't be displayed because information isn't provided, but they are just that, they're warnings. They're not errors and they can't stop submission for you. Some common warnings I've seen this far include on the ACI report, provider has less than 100 summary of care. This is one of those measures you can claim an exclusion for. So if you have less than 100 in the denominator for the HIE or e-prescribing measures, it will give you a warning, but again, you can ignore this and you can still report on that measure. A similar warning is actually found on the quality reports. It'll say provider has less than 20 in the denominator for a measure. The case minimum for the quality category is 20, meaning if you have less than 20 in the denominator, you are only able to get 3 out of 10 possible points for a measure. If you still want to report on a measure with under 20, because let's say you're getting 100% and you don't have any other measures you have data for, you're allowed to do this. Again, it's just another friendly reminder that NextGen has put in there. Before you can approve a file, you must resolve all errors and then actually request an evaluation and regeneration of the report. Corrections should be completed and reflected on the practice summary report if you're doing group reporting, or the summary report for individual reporting. The client admin user will then have to regenerate the program submission file. Again, a generating message will appear while it's processing. And then just a side note, if all files have been approved, that regenerate option is not available. Once your program submission files show no warnings or errors, you should again review the contents of the file to confirm it's correct, specifically looking at the NPI and TIN. Once confirmed it's correct, approve the file by first checking the box regarding the legal statement, and then click the green Approve button. Once approved, the file is immediately queued for submission to CMS via the CMS API site. Submission happens immediately or within 1 hour. It depends on the number of files you have queued and the load time to CMS. And I know it's a bit blurry, but the file shows that it was approved, the actual client admin username that approved the file, and then that date it was approved. Now, I've had a lot of clients ask me, how will I know when it's submitted and accepted by CMS? On the old CMS portal, we get a notification saying it was accepted and CMS had it, which they would then screenshot and keep in their audit binder. This year, if you go to the program submission page and click View File, you will see the file names and status. Files that are approved are green, like the top image, and files submitted and accepted by CMS are blue. CMS also returns a CMS ID, which is to be used for reconciliation. So clients can screenshot this for their records as proof of submission. Date the file submitted is also shown. It's displayed if it's clicked as well. And again, this functionality is the same for the ACI quality and improvement activities categories. Again, it depends on how busy the HQM and CMS servers are, but most clients are able to actually go back in after approving their files within 5 or so minutes, and that status will have changed from green to blue to screenshot that page for their records. Now, this timing may change once we get closer to the submission deadline, since we anticipate the volume of submissions to increase. There is the possibility that your files are rejected. Rejected files by CMS display along with the error for the rejection. Rejection should really be discussed with an HQM implementation specialist. Corrections and resubmission will be needed following the same process as original submission, so you do have the opportunity to fix this. Now, knock on wood, I have not had any clients' files be rejected so far, but I do encourage you to start this process as soon as possible, especially since the NextGen HQM deadline is March 16th, and that's not that far away at this point. It takes time, as you can tell now that we've walked through it entirely, to configure down your reports and add the measures you need for attestation and regenerate them, then address any errors and warnings and possibly regenerate them again. And then, God forbid, if you had a file rejected, to have to do all of that over again, it can be quite the time commitment, more than what we would think to get it right. So my advice to you is to go ahead and start this process as soon as possible. So we're done with the entire program submission process from start to finish. But I wanted to add a few slides in here about an added functionality I'm really excited about within the HQM, and that's the MIPS Dashboard. This MIPS Dashboard allows participating providers to monitor their performance for the IA, ACI, and quality categories of the MIPS program via real-time feedback from CMS. The dashboard displays provider performance data at both the individual and TIN or group level for generated submission files prior to submission and after. The performance scores are based on data calculations returned from the Quality Payment Program Submissions API. So providers receive a preview of scores prior to submission and their scores after submission in each category, as well as their MIPS final score, which is the sum of the weighted scores of each category. What I do want to throw out here as a sort of disclaimer is that this score is only a preliminary score. It's not your final composite score. This is a very good indication of what your final score will be. However, any special statuses or consideration your practice may have, such as being a small practice with under 15 clinicians, will not be taken into account here. The user can go to the HQM homepage and select reports and then MIPS Dashboard to use this tool. Again, this dashboard actually provides the following information in sortable columns. Provider name, if you're looking at individual reporting. If it's group reporting, this will not show up, as well as NPI. And then TIN, status, IA score, ACI score, quality score, total score, and then evaluation date. The status will show you if your file would be rejected for some reason by CMS. And your eval date is the date of the last HQM evaluation. Now, when viewing the dashboard, you can view either two types of scores, the preview score or the submitted score. Preview scores enable you to see your initial MIPS performance category scoring based on your measures data. The HQM portal does this by periodically reporting your measures to CMS Submissions API through the web service. The Submissions API calculates performance scores based on your data and then returns your scores as well as other feedback about your data. Preview scores display your latest performance data received from CMS. However, you can also view historical data returned from CMS to identify trends in your scores. You can do this by clicking on the total in the grid on the dashboard, which will show you the preview score breakdown. You can then click the gray bar with graph symbol to see historical trending for summary reports generated to date. To view scores for submitted files, you just go ahead from the drop down and click Scores Type Submitted. Status will reflect OK and scores will display. If the file has an error status, it will reflect error. It'll be red. You can go ahead and click that error to see details. Again, the score returned from the CMS's site is only a preliminary score. As I said before, it doesn't account for those small practice or special status considerations. We do want to point out that submitted scores are updated through a periodic batch process. As a result, there will be a delay between submitting your QPP data and receiving your final submission score. Also, because submitted scores are the performance scores received based on your final submission, they only apply to a single data set, so you can't view historical data. Historical data is only going to be available for your preview scores. If for some reason CMS encounters any errors as it evaluates your measure data, it will return the error details in your feedback along with your performance scores. On the MIPS dashboard, in that status column, instead of a green OK, you would see a red error. You can view the details of the error messages to identify problems with your data and take corrective action. So if you click on that, the error report window appears, and you can actually share that error with the HQM team by clicking Send Email and inputting your HQM analyst's email address, and it goes right to them. And then lastly, before you guys can finally get rid of me, I wanted to talk about the CMS portal on the QPP website that can be used to also submit your data instead of using the NextGen HQM. Now, this really is my own personal opinion combined with what clients have told me. I've heard the CMS portal is pretty great this year, which is a step forward compared to previous years. However, there are some valuable features the NextGen HQM offers NextGen clients that the CMS portal does not. The biggest one is confirmation of submission with CMS ID and status. On the CMS portal, your data is uploaded or inputted manually, and then it just sits there. There's no submit button or approve button. Whatever is in there on March 31st is what will be used to score your provider. If you're like me, I need some sort of confirmation or feedback that CMS has my stuff, so this is huge. The fact that the HQM gives you an accepted status with an ID number, or even an error status with an explanation, at least allows you to know for certain they have it or not, and also allows you to take a screenshot as physical proof in case of an audit or any type of issue. Secondly, there's no need to download reports and then re-upload them. Don't get me wrong. I understand the entire configuration process can be a bit much. I mean, we just effectively spent the last hour going through it all. But it's still, in my opinion, easier than downloading files that probably should have been configured regardless, and then uploading them. Making sure everything transferred over correctly, that you have the right file formats, all of this can cause a headache. Kind of leading into my next bullet here with the HQM, you have more control over measures submitted, or at least I feel that way. Anything you submit via HQM, you added yourself, and you actually selected to include. with the CMS portal, if you upload a huge report with all of your measures, you aren't sure what they will select as your top performing to submit. And finally, another big one is not dealing with logins. Correct enterprise identity management system accounts, making sure you have the correct role in the CMS identity and access management system, having to link providers to the user to submit on their behalf. This was all extremely difficult most times. When I used to help clients with meaningful use attestations, I always said the hardest part wasn't getting the provider to pass all year or even inputting the data manually. It was getting the providers or those working on behalf of the providers simply logged in. The CMS portal on the QPP website still requires you to have that login, as you can see in that screenshot. Again, I think both are great options to submit your data. They have come a long way compared to previous years, especially being user-friendly. But I often get asked why I recommend the HQM portal, and I just wanted to share those reasons with you. All right, looks like we've made it to the end here. If you are wondering what your next step should be, or if after all of this information you're uncertain with where your practice stands, please let us help. We can assess your current readiness, provide recommendations, and even implement new processes and procedures. We do actually offer MACRA support packages where you'd be working with me directly on this. I promise I don't actually talk this much when I'm on client calls like I'm forced to with these presentations. We can sit down and see what package is best for you based on your needs. I've had a ton of clients choose the MACRA Fundamentals package, which is up to 10 hours for a one-time fee, just to help them with the submission process, make sure their HQM setup looks good, and get them ready for 2018. The other two packages are ongoing and provide more support. Really, we just want to help you all do the best you can under these value-based programs, and we want to tailor these to your needs. So go ahead, visit us at attentive.com, continue to sign up for these webinars, check out our blog, and then consider our 3-day fixed price on-site consultations for clinical workflow, revenue cycle and front office, and technology and performance, and then also test drive our products. Okay, time for questions. As always, thank you everyone for joining us today, and I'm going to go ahead and turn it over to Chelsea.
Great. Thank you so much for that, Lindsay, and thank you everybody again for joining us. Lindsay, I would recommend that you pull up the questions in your own screen as well, so you'll be able to see these. A couple of them are a bit on the longer side, which is awesome, but might make it easier for you to follow along. Again, if you have questions, you can type them in the questions area of the webinar control panel, and we're just going to go from the beginning and answer them in the order that we received them. So this is a question about configuration of HQM. I have 30 multi-specialty providers reporting as a group. 6 of those providers have no patients in the denominator for the group selected measure. I understand that because we are reporting as a group, those providers will get credit for participation in spite of having no patient in the denominator. Those providers also have not had the opportunity to participate in most of the ACI measures, and they were not involved with the AI activities. My question is how to configure HQM. It looks like I have to configure all providers with the quality and ACI measures, or I will get an error, correct? What about the AI measures? Configure all providers whether or not they were involved to the AI activities? Thank you.
I see what you meant about pulling up the question stocks. I definitely appreciate the thought put into that question. It is a great question. So what I'm understanding here is that you obviously have a very large multi-specialty practice. You have providers that are performing well on some measures and some providers who maybe those measures don't apply to. So based off that question, it sounds like you're reporting as a group versus individually. So if you are reporting as a group, if your providers are in the HQM and active and associated with that TIN, you are correct, you have to have them all configured identically for each of those categories. If you don't want to report data on them, you would have to actually disable them on the config practice tab in the HQM. It sounds like you would be able to actually configure all the providers. All the providers don't actually have to contribute to each measure. There's a certain threshold for data completeness that it sounds like you would be above. But again, this sounds like a pretty practice-specific thing. We would have to talk further and actually look at the providers you have and the data they're contributing. But again, you are pretty much right. If you're reporting as a group, you need to have all providers configured for each of the 3 categories.
Great, thank you, Lindsay. Next question. Do all providers need to complete the non-mandatory self-attestation measures? For example, we are doing specialized registry reporting on most but not all providers. Reporting as a group, do I attach all providers or only those participating in the registry?
Thank you. That is a great question. So because you specified you're reporting as a group, even if not all of your providers in the group are reporting to that specialized registry, if more than 1 or 2 are, you get credit for the entire group. So yes, you would need to add those non-mandatory or that specialized registry reporting self-attestation measure for all of your providers because your configuration has to be identical for all of them. And yes, they should all get credit.
Great, thanks, Lindsay. Next question. What do we need to keep from the submission process for our audit binder?
So what I've been suggesting to clients to do here is there's not a ton you can actually download or screenshot and keep, but I suggest you run and download your summary reports that match the data in your submission files for each category. Then download the actual raw data file by clicking that download button in the file viewer. And then finally, I would have a screenshot of that view file page with the status of your files as blue with the CMS ID proving acceptance. Those things should really suffice. You can always grab additional screenshots and things like that. And one thing that's nice with submitting through the HQM portal is that once your files are submitted, you can still have access to them. So if you go into that program admin and then program submissions page, you can still view those files and download them and save those even after you've approved them. So you should always have access to them as well.
Great, thank you, Lindsay. It looks like you might have already answered this question, but I'm going to ask it again so you can confirm. How should I deal with reporting as a group where some of the providers, but not all, meet the exclusion criteria for e-scribing and have 0 in the numerator?
So with this one, if you're reporting as a group, you should be running your practice summary report. This would be just one report that you're looking at. If you're running it individually, that's not actually how the group data is run and actually not how it will be submitting. So if you're reporting as a group, run that practice summary report. And if you have a 0 in the numerator for either the health information exchange measure or the e-prescribing measure, you would want to go ahead and claim an exclusion because otherwise you would not meet those ACI-based measures. So again, if you're reporting as a group, it should just be one file instead of multiple individuals. If you're reporting individually, that's different. You can actually claim the exclusion based on the individual provider that needs it.
Great, thank you for that, Nancy. Next question. Can you briefly explain the ONC ACB attestation? Do we need to attest to that? I missed it in the discussion, thanks.
Sure, no problem. Yep, so there are these self-attestation measures that have been added to the HQM. They have been added because of the ability to now submit your meaningful use, your ACI category data using the HQM. If you remember in the BASC meaningful use days, you had to click through, I think it was 3 screens and say, yes, I attest to this before you even got into the portal. That's what these 3 measures are, the prevention of information blocking, and then there's 2 ONC, they're called pre-attestation measures. You would want to add all 3 of those for each of your providers if you're doing individually, or the whole TIN if you're doing group reporting. And you do need those or you're going to get an error on your program submission file, which will actually prevent you from submitting your data. But again, those are just attesting that yes, you are doing these activities. You can again hover or click on the measures to actually read the description of what you're attesting to. But for example, the information blocking, it's just saying that you have not knowingly participated in the blocking of information.
Great, thanks, Lindsay. And it looks like this may be our last question. How do I know which program submission files to generate and view?
I can grab that one too. So really, this just depends on the programs you have configured. So how to look at this, the names of the programs you're using to actually track your data. For instance, if we did ACI Individual 2017, it'll match exactly to the titles of the files available for submission. Another helpful hint is once you generate the files, under the file name on the program submission page, it will say generated : and a number. And then right underneath that, it'll say approved : and a number. Any file that's generated and is not approved that you wish to submit are the ones you need to actually go in, view, review them, and approve.
Great. Thank you, Lindsay. And thank you, everybody, for joining us. Again, if you have questions, you see Lindsay's information up there on the screen. Feel free to reach out to her. Otherwise, I'll be following up with a link to the slides and recording from this within the next week, so you can always reply back to that email as well if you think of questions after the fact. We're really here to help, so let us know what's on your mind, and we'll help you as best we can. And I hope you have a great rest of the week. And Lindsay, thank you so much for your hard work on this presentation.
Thank you, everyone.